Chronic Repeat Services, or CRS for short, is dedicated to patient well-being and saving lives. CRS technology helps remind the patient to take their medication, and it also provides an overview of behavior in relationship to the medication as to when it is taken or when it is missed. Now, which helps the patient to manage their health. CRS delivers a personalized and immediate support directly to patients via the app, offering patient medication management with convenience, which ultimately helps the patient to take their medication regularly and to manage their chronic condition. CRS also coordinates script refills and renewals, and it instructs the pharmacy to have medication ready for the patient when they need it. CRS is a one-stop shop for you, the patient, to lead a safer and a healthier life. Good afternoon and welcome again back in studio and online. Today we've got our very old and friendly and professional guest, Dr. Gabriel Jones. Good afternoon, Doctor. Welcome to today's session. For our newcomers to the show, just please introduce yourself and just give us a short bio on your experiences. Thank you, Doc.
Hi, I'm Dr. Gabriel James. I studied at Wits University and I'm currently working as a general practitioner in Imams and Toti. Thank you for having me today.
Thank you, Doc. So, of course, today's session is sponsored by Chronic Repeat Services, and today we're talking about diabetes and specifically diabetes 1. Doctor, I'm going to jump into the questions and ask you immediately, what is diabetes specifically? And then, of course, diabetes 1. Thank you, Doc.
There are two main types of diabetes, type 1 diabetes and type 2 diabetes. Both types of diabetes are chronic diseases that affect the way your body regulates blood sugar or glucose. Glucose is the fuel that feeds your body's cells, but to enter your cells, it needs a key, and insulin is this key. People with type 1 diabetes don't produce insulin, which means that their cells are unable to use glucose for energy, and this glucose then stays in the blood, causing problems. You can think of type 1 diabetes as not having a key. It's often a disease that has a strong genetic component and is often inherited from your parents or your grandparents, and it's diagnosed a lot earlier in life than type 2 diabetes. And the core problem is that the pancreas just is damaged and doesn't have the ability to produce enough insulin to control the body's blood sugar levels.
Thank you, Doc. Tell me, how is type 1 diabetes managed?
People with type 1 diabetes need to replace insulin via insulin injections or an insulin pump. The insulin acts to reduce the level of glucose in the blood. They also need to be careful about what they eat so as not to push their blood glucose levels too high, as they'll be unable to bring them down without additional insulin injections or the insulin pump.
Tell me, Doc, what medication do diabetes have to take? And then also, how often do they need to take this medication?
Type 1 diabetes is quite a serious condition which needs to be monitored very closely throughout the day. Type 1 diabetes is managed with insulin replacement, either through lifelong insulin injections, which can be injected up to 6 times a day, or via the use of an insulin pump. Patients also have to monitor their blood glucose levels regularly, also up to 6, if not more times a day, or as directed by their specialists. And they're required to follow a healthy diet and eating plan. The aim of diabetes management is to keep the blood glucose levels at a target range or as close to the target range as possible. And this is generally between 4 to 6 millimoles per liter when fasting. However, the ranges will vary depending on the individual, their age, and their individual circumstances.
Thanks, Doc. And tell me, what will happen if a type 1 diabetic mistaking their medication?
The most serious complication of type 1 diabetes and when they forget to take their medication is that they might fall into a diabetic coma from excessively high sugar levels. This is an incredibly dangerous complication and requires urgent hospital admission and attention. Patients with longer-term poor compliance also become vulnerable to severe and chronic long-term health complications. Some of these include an increased risk of blindness, kidney damage and kidney failure ultimately, severe heart and cardiovascular disease, as well as several sexual health complications. One of the other serious effects of skipping diabetes medication can be feet problems. When a diabetic patient misses the medicinal doses for a long time, the patient becomes more prone to suffer from severe nerve damage in the feet, particularly. This nerve damage can create serious problems for the person's feet. The feet loses its sense of touch and pain, and thus a person may not even realize if there's a cut or an injury to the foot. These wounds then become infected and they are incredibly difficult to heal because of the often poor lack of blood supply to the feet. And they often get amputated due to secondary infections.
Yeah, I think it's sad. I had a friend who was a diabetic, and in fact, they had to amputate his foot, so which is not good. Tell me, Doc, are there any side effects from taking injections over a long period of time?
The side effects of taking insulin injections just depend on the type of insulin you're taking and for how long you're taking it for. Some of the common side effects include initial weight gain as the cells start to take in glucose. You can have your blood sugar dropping too low, which is also called a hypoglycemia, and can also make you fall into a coma. You might develop a cough if you are taking inhaled insulin, and rashes, bumps, and swellings at the injection sites are quite common as well. All of these side effects can be managed with the help of your healthcare provider. In the case of bumps and swelling at the injection sites, this is often due to what's called lipohypertrophy, where fat cells in the area start to build up because of the insulin injections and insulin itself. To prevent this, patients are often encouraged to give the injection site a break by alternating where they inject the insulin every day.
Doc, tell me, what are some simple ways that a diabetic can manage their disease or this disease?
Type 1s need to have regular checkups with their GPs or more commonly with their specialists because it's a really difficult disease to control and it requires expert care. They also need to try and manage their stress. They should not ever start smoking, and if they have, they should stop. They should be careful with alcohol and ideally avoid it or keep it to a minimum. They should follow the diet plans given by the specialists or the nutritionists, and they need to monitor their sugar closely, and most importantly, they need to stick to their insulin dosing schedules.
Now, I think the question is, how can patients be reminded to take their medication regularly? Well, there's a new app available. And this app is made specifically for South Africans, and it is called the Chronic Repeat Services, or for short, the CRS. Now, this app allows patients to easily order their chronic script every month, and it also ensures that the medication is prepared in advance and made ready for collection and or for delivery. It offers patients peace of mind, and it helps to ensure that they never run out of their medication.